Under the influence of cannabis.
Cannabis is often seen as harmless or natural, but misuse over time can affect almost every system in your body. It alters the brain, weakens the lungs and heart, disrupts hormones, and increases the risk of long-term mental health problems. The greatest danger comes from high-strength THC strains, which can trigger addiction and even psychosis in vulnerable people. Cannabis changes how the brain's chemical messengers work. It releases dopamine and serotonin, creating feelings of calm or euphoria. But long-term use can cause anxiety, paranoia, and memory loss. Over time, concentration and motivation decline, and dependence may develop, with withdrawal bringing irritability, insomnia, and cravings. Within minutes of use, heart rate and blood pressure rise. This increases oxygen demand, putting extra strain on the heart. For some, especially those with heart conditions, cannabis can trigger palpitations or even a heart attack. Smoking cannabis irritates and inflames the airways, leading to persistent cough, phlegm, and reduced lung function. When mixed with tobacco, it adds carcinogenic risk. Regular smoking also exposes users to toxins similar to those found in cigarettes. The liver processes cannabinoids and other chemicals from cannabis. Long-term use, especially with alcohol, can inflame and damage the liver, worsening existing conditions. THC expands blood vessels, causing red eyes and sometimes dizziness. Over time, chronic use may raise the risk of stroke or vascular disease. THC suppresses immune cell activity, lowering the body's ability to fight infections. Frequent users may find they get ill more often or take longer to recover. Cannabis slows reaction time, balance, and coordination. Long-term abuse affects neural connectivity, leading to slower thinking and cognitive decline. Users often feel relaxed, but muscle response slows. Performance, reaction time, and coordination all decrease, raising the risk of accidents. Cannabis often increases appetite, the familiar munchies effect, but in long-term heavy users, it can cause severe nausea and vomiting, known as cannabinoid hyperemesis syndrome. Reduced oxygen levels and smoke exposure dull the complexion and accelerate aging. Chronic users may experience acne, dryness, or inflammation. In men, cannabis can lower testosterone and reduce sperm count. In women, it can disrupt ovulation and fertility. During pregnancy, THC passes through the placenta, potentially harming fetal brain development. Cannabis doesn't just calm the mind, it can cloud it. Long-term abuse can rewire the brain, trigger psychosis, and take away the motivation to live the life you deserve. Do you need help with your addiction? You don't have to face it alone. At UKAT, we provide confidential advice, expert treatment, and 24/7 support to help you take back control of your life. Call us today on 08081 633227 or visit www.ukat.co.uk. Recovery starts with one conversation.